Hi everyone, welcome to Youth Free Conference session, Answering the Hard Questions, HIV Cure, Adolescents, and Youth. We'll be joined by three speakers today. Our first speaker is Professor Sharon Lewin. Professor Lewin is an infectious diseases physician and a scientist. She has worked in HIV-related clinical medicine and research for over 25 years. She is the director of the Peter Doherty Institute for Infection and Immunity in Melbourne. Professor Lewin is internationally recognized for her expertise in the field of HIV cure, HIV hepatitis C co-infection, and immune recovery post-ART. She leads a large group focused on basic and translational science and early-phase clinical trials for cure intervention. Our second speaker is Josephine from Uganda. Josephine works as a youth program coordinator for psychosocial activities at Mercury University. She is an ambassador for Elizabeth Glaser Pediatric AIDS Foundation in Southwest Uganda. She advocates for better treatment options and psychosocial support on international platforms. She is also a national trainer of the Young Adolescents Peer Support in Uganda, supporting Ministry of Health to design and implement a standardized peer-led model. Currently, she organizes on-site facility sessions to provide accurate information on HIV cure statistics. Last year, she published her book called Beyond Your Status. Today, Josephine will be talking on HIV cure perspectives from the field. Our third speaker is Aurelio. Aurelio obtained his medical degree and master's degree working at his home country, focusing on antiretroviral drug resistance and HIV persistence in the context of immune activation. He has taken part in academic and research trainings in Canada and the UK. He was awarded a fellowship for the IAS Research for Cure Academy. Currently, he is pursuing a PhD degree at the Institut Pasteur in France, a grant from the University of Paris. Aurelio will be talking on making the case for millennials and HIV cure research. We are going to start with Professor Lewis, who will be giving us an overview of HIV cure research, where we are, and how it applies to young people living with HIV. Hi everyone, me again. As you know, these virtual conferences are a huge learning curve for all of us. And as I just said, today we were going to be joined by Professor Sharon Lewis from Australia, but due to technical reasons, we are having some issues, but we didn't want to skip her part, and I wanted young people to have a chance to learn more about cure strategies. So without any preparation, I'm just jumping on the camera and improvising and trying to talk about cure research. This should be fun. Maybe I can tell you a bit about why I thought I could be talking about HIV cure research. IS has an HIV cure program, which is called Towards an HIV Cure. And there was this capacity building program called Advocacy for HIV Cure. And I attended that program a year ago, I think. And in that program, we talked about why we still don't have a cure. What do we need to do so we can achieve a cure? And what are the strategies that are currently being tried. So I want to talk about why we still do not have a cure and why it is such a hard topic to get over, kind of. So one of my friends, when I first entered the field, which was about 3 years ago, told me why we don't have a cure like this. He told me that I should think of our bloodstreams as the roads inside a city, and the viruses that are in our bloodstream also as the cars on the street. But the thing is, cars, meaning the viruses, can go into parts of our body that are not on the street. And when we have medication, which is simply just trying to kill the cars, viruses on the street, which are viruses in our body, the cars, viruses can go into part of the body, street, that medication cannot go. So there are some type of barriers as to where the medication chemically can go in and cannot. And examples of these are some organs, some cells, some tissues. It can be our brain, for example, because there's a barrier around the brain that prevents everything going inside the brain. But viruses, for example, HIV, can go into that part of the body, but chemical treatment cannot. And therefore, we have latent reservoirs, which is simply where the virus can hide and stay there for a while. And if they feel like waking up and going around and attacking the immune system, they do that. But until they wake up, we still do not have a way to find where exactly they are, so we can attack them, kill them, or whatever you want to say. So basically, this is the challenge that the HIV Cure trial and all the research is trying to overcome. How we point out where the virus is going to sleep, where the reservoirs are, and how we can make them active again, make them wake up, so we can pinpoint them, and then we can attack them. But as I said, there are different approaches and strategies that is being tried, and actually researchers are kind of divided because they all want to support their strategy and their trials, but we currently do not know what works best. You might know there are a couple of people, like the London patient or the Berlin patient, who have been cured of HIV, but we also know that the processes they have gone through are very strong, and they were only able to do those processes and survive those processes, so to say, because there was nothing else to try, and they consented to try those procedures. But currently, those processes that can be cell transplants and other stuff, or chemotherapy and so on, we currently cannot do them to everyone because they are actually really risky, and it is not good for everyone, let's say. So I want to talk about different strategies so you have a bit of idea of what is being tried and what might work, and if it works, who is it going to work for. So we know that, as I said, there are reservoirs where the virus falls asleep. So the most simple thing is find a way so you can wake that reservoir up so we can pinpoint an attack and kind of make that reservoir disappear. This strategy is being called kick and kill. Basically, find a sleeping reservoir and with an agent or with something make that reservoir active again so we can kill the viruses that is going to come out of that reservoir and make sure that the reservoir is gone. So this was the way, in a very simple sentences, that it was described to me, which actually made it easier for me to understand. But there are also other things. For example, cell gene therapy. As the name says, it's a gene therapy, which is very complex. And since I had no preparation for this part of this slide, I am not going to go into detail. But we also know that there are certain mutations that are in our DNA. And for the London patient, or for people that have been cured of HIV, we know that the strategy they used was built on top of that gene mutation. But the issue there is not everyone has this gene mutation, and some people have it on the both sides of the DNA, and some people only have it on the one side of the DNA. And for that to be effective, that gene mutation to be able to protect you from acquiring HIV in a way, that mutation needs to be on both sides. If it's on one side, that is not active. And we know that only a small percentage of the population has this gene mutation. So what they tried to do was they tried to, I don't remember what it's exactly called, which I should. It was a cell transplant. It's something like bone marrow cell transplant that you can inject the other person with the DNA that has both of the mutations on both of the sides of the DNA, so you can actually find a way to transfer that mutation, which is kind of an immunity, to someone else who does not have that mutation in their gene code. But if you insert that gene code and that cell transplantation, afterwards the immune system can continue producing immune cells that is going to be just kind of immune to the HIV. So this is one of the other things that is being tried. There are also latent reserving agents that are being tried, which is actually what kick and kill is actually about. And maybe we can go back into a bit more basics and why do we need a cure? We can talk about this. We need a cure because HIV treatment, although we had many advancements, is still not available for everyone. It is not easy to access for everyone. And most importantly, it is not effective for everyone. And people, depending on their health, their life, and many other stimuli, I'm going to say in German, many other dependents, it might just change and the treatment might not be best for them. And as we all know, we have to go to a clinic every 3 months or 6 months so we can access the services, get our treatment, and get our tests done, which is not easy, especially if you're a young person and you're trying to build your future and see where you want to go in life. But also you have that thing you have to do every 3 months or 4 months or 6 months, wherever, depending on where you live. So these are the reasons that we need to achieve a cure, and these are the reasons we need to support the cure research. But there's also another interesting point about the cure research. As you might know, all cure trials, or all clinical trials, have to have a community representative in them. That person is simply making sure the papers and everything that is going to be published is understandable and acceptable for the community, for people living with HIV. But when you look, I am being a bit political here, when you look, most of these community representatives, usually I'm going to say over the age of 40, but if you think, we are, as the young people, most likely the ones that the trials are going to be on. Because I probably have less health issues or underlying conditions that may be a problem for the trial. But when you look, I am not aware of any young person being the community representative, especially for the cure trial. But most of the cure trials need to enroll patients who are actually either recently diagnosed, so they have less latent reservoirs, or just so they can go into the trial and they will not be excluded for whatever reason. But when you think, if we are the ones that are going to be worked on, let's say, why am I not represented as the community? Because I definitely feel we have been growing up in a different environment and different society, and how I see things and how I understand things is actually different from my older generations, my older peers, so to say. If we go back to Cure, that was just something that I wanted to insert about the Cure trial. If we go back to Cure, there are also other things. We need to think who that mutations or to whom those strategies will be accessible. We already know that making sure a treatment is accessible to everyone isn't easy. If a cure becomes available, we have to start thinking, how is it going to be delivered around the world? Will I have to travel to London? Will I have to travel to Berlin to get treatment and cured, so to say? These are the questions we need to think about. If we already do not have the infrastructure to deliver treatment to all around the world, let's say we found a cure in 5 years, which is kind of likely, or let's say 5 to 10 years might be the earliest time we might find a cure. But how are we going to deliver it to everyone? I already have friends who do not have accessible treatment options. How are they going to get cured? Is it also going to be another drama we have to deal when we get there? Maybe we should start thinking about it before we get there. And since the researchers are focusing on how to find the cure and how to make HIV disappear in the body, I think advocates need to start advocating and start working on how are we going to deliver it when we find it. Another interesting thing was, are there any differences between men and women? I don't like being too binary, but we know medicine is a binary subject and there are actually reasons for it. And some of the reasons that there are differences when it comes to men and women is we already know HIV progress is different in women than men. And we know that, for example, women have lower viral loads compared to their counterparts. And data also suggests that women are overrepresented as elite and post-treatment controllers. And we also know other infections like hepatitis B have clear sex differences between women and men in the pathogenesis burden, prevalence, and disease progression. So these are also things that we all need to think about. If we find a cure now that is not going to be on the market until 5 to 10 years, but when it's on the market, is it going to be just for the Western societies, or are we going to try to make sure that it's going to be accessible for everyone? And also another question is, how are we going to make sure people understand it? It is not an easy subject to understand, and if I'm going to go through a process, I want to know what that entails and what it means. I am already very picky with my medication that I have to take every day, and if the successful cure approach, let's say, is something very clinical and hard to explain, am I going to say, okay, I don't need to understand it, I give consent? But why wouldn't I understand? If I want to understand it, how am I going to understand it? And I think as HIV activists and advocates, we should be the first ones trying to understand it, break it down, and if it's not understandable, say it is not understandable, and we need to break it down, because me and my peers are not going to understand it. So these are the things that comes up to my mind when we talk about Cure trials. As I said, Cure trial is one of the most advanced and complex aspects whole HIV field, it is very interesting, but it's also really not easy to understand. But if you want to understand it, there is a way to understand it. Just ask questions. Reach out to people who are actually leading those researches and say, I read the paper, but I didn't understand. Maybe then they will try to make it more understandable. Maybe that research paper shouldn't be 10 pages, but it should be 20 pages, and everything should be explained in a longer sentences and more understandably. I don't want to take a lot of your time, and I think these are all the things that I wanted to say about HIV Cure researchers. I'm trying to save some time to think if I missed anything that I wanted to talk about. I think that is it all I wanted to say about HIV Cure. These are all the discussion points that we should discuss. As I said, you might want to go and Google different strategies so you understand them better. Each one has a different clinical background or different thesis that they are based on. And I also know there is going to be maybe today, I'm not sure, there is going to be a discussion between John Frater, who is the leading researcher in Oxford University, and Sharon Lewin from Australia, who was supposed to be joining us. If we didn't have technical issues today, there will be a discussion between two of them where they try to convince each other whose approach is better to achieve a cure. If you can find that on IAS's conference program, you might also want to watch that, because they will talk about why their approaches are better and why it is easier, let's say, to achieve the cure and why they are more likely. If you want to learn more about different approaches and how they performed so far, you can also try to find that session. And as I said, both of the speakers will be leading researchers. That's why the session, I think, is going to be interesting. Before I continue rambling for another 10 minutes, I want to introduce our next speaker, who is Josephine. Hi, Josephine. And Josephine will be talking about perspectives from the field. Take it over, Josephine.
Hi, everyone. My name is Josephine Nabukenya. I'm an HIV Cure fellow in Uganda, but I also work at Moji Care Limited as a youth program coordinator for psychosocial activities. I also support Elizabeth Blazer Pediatric AIDS Foundation in southwestern Uganda. I'm here to present about the HIV cure perspectives in our communities. Well, as you all know, HIV has been with us for more than 30 years, and there has been significant developments in treatment and other services. For example, testing. We have seen a shift from CD4 cell testing to viral load and to resistance testing. There's also been sensitization and PLA discussions, both at facility and community levels. However, discussions about an HIV cure have been left out. Why? Well, there are reasons, and one of them is very few health workers are equipped with information about what is happening around an HIV cure. And we all know, if you do not have the information, then you cannot lead the discussion. HIV cure information is too scientific for some health workers to digest. And in this case, I'm giving an example of an adolescent peer who is 18 years, a youth peer who is 22. Some of this information can be too scientific for them to digest. And if they do not understand it, definitely they will not lead the discussion. And lastly, there is limited information given to the community about the few cure researches taking place within our communities. Well, we all know that among all the researches taking place, definitely different researches are happening around an HIV cure within our communities, especially if they're developing communities. However, even those few researches that are happening, people in the community never get a chance to get to know about them. And because of those reasons, adolescents, young people, and the entire community, they all have different perspectives about an HIV cure. And these are the current views that people think about when we go to the community to address HIV cure information. These are the common things that usually come out of the community members. And one of them is only prayers cure HIV. People believe that through prayers, one can be cured. After all, scriptures say that nothing is impossible before God. So people believe that through prayers and through having faith in your prayers, you can actually get cured of HIV. Other people also believe that most people prefer treatment to cure because they would lose their jobs, they would lose their market if the cure was made available. Therefore, an HIV cure will never come. So here, most quarrels give an explanation of there are so many people that are being employed into this HIV field. If an HIV cure came, many doctors, many scientists, many health workers would lose their jobs. So in such cases, such people would think that they would prefer their jobs than actually an HIV cure coming. Likewise, for all the companies that are making drugs, ARVs drugs, people think that they would prefer to always continue making treatment than actually delivering a cure, because that would mean that they're going to make a little profit in the long run. Another view is that pygmies and virgins, once you have sex with them, they can cure HIV. So pygmies are very short people in my community. And there is a very, very big myth that when you have a problem that cannot just go away like that, when you associate with them, you can transfer your problem to them. And that way, HIV is, in this case, also looked at as a problem. So people believe that when you have sex with a pygmy, or when you have sex with an albino, you transfer your HIV to them, and then you'll be cured of HIV. The other view is that people think that the cure is already available, but it can only be accessed by the rich people. So people think that for all the 30 years, there is no way that an HIV cure has not yet been developed. However, if it is there, it is only accessed by the rich people. People also think that through complete blood transfusion, one can get cured of HIV, and this has a connection with the fact that people think that the cure will only be available for the rich people, because complete blood transfusion is not something that can be done by a person who is not so rich, because it would they think it would involve transfusing blood every after a certain period of time, which will take up to a year or 2 years. So if a person completely makes a blood transfusion for a certain period of time, after some time, like 3 years, they would be completely cured from HIV. And lastly, people think that an HIV cure will be made accessible to the Western world, leaving out the African countries. And this is a myth that commonly comes from people who have had information about a cure somehow, somewhere. They know that some of the people that have been cured are all coming from the Western world, so they think that the cure will come, but probably it will only be accessible to the Western world, and African countries will not access it. So those are some of the current views that people think about an HIV cure in our communities. Well, in some of the discussions that we have held, I had a moment to question a 16-year-old boy about how they think an HIV cure will look like, or what an HIV cure means in their world. And this is what they had to say. They said that an HIV cure would mean getting rid of daily pills. An HIV cure would mean getting rid of going to the hospital every month or 3 without feeling any pain. They also think that getting rid of hiding when going to take drugs, that is connected with stigma and discrimination. And they also feel like an HIV cure will come and it will make them feel normal like any other person. Thank you so much.
Okay, well, first, thank you for the invitation to this talk, making the case for millennials and HIV cure research. So I want to talk a bit about millennials. This is a very fancy word that we have been hearing a lot. Actually, if you Google or try to look for the definition of millennials, you can find a fair variety of definitions. They're often associated with the use of new technology, social media, freelancing, environmental concerns, and among others. But I think one of the key points to understand what millennials are is trying to know or understand that they have grown during disruptive changes for the past years. But it's not just about millennials, it's about generations that are now living together for the past years. We have many generations that have been without an HIV cure, and some of them have been through rise and live in different countries and live through major breakthroughs, wars, for example, the vaccine movements, the land mooning, the internet, the AIDS epidemic itself. Now with the technologies like the internet, the social media, among others. So it is about understanding the context and how we have been all grown, generations have grown through different texts. And in all of these contexts, when we have disruption, this can influence the way that we live our lives and interact with society, make changes, for example, through technology, can have an impact in our health, professional, personal developments, and social behavior. And this can translate for generations in positive and also can be in negative ways. For example, for the HIV, we had a rise in the number of deaths, and the epidemic has been seen very differently for the past 3 years to what it is now, and has influenced the life expectancy, for example, the relationships, the family planning, and of course the stigma. And after that, we had the antiretroviral treatment. It was an important disruption that lowered the number of deaths for the past years. For example, for the sub-Saharan African countries, has been dramatic changes due to this antiretroviral treatment. We actually can see the lower life expectancy with the HIV epidemic, and with the introduction of the treatment, we can see a rise in the life expectancy. So we know that changes through time can impact the life of people and societies, and HIV Cure is a major subject, so that has the potential for a major disruption. So we think regional changes, we need to think about coincidence and difference. And major coincidence is that we need an HIV cure in order to end stigma, among others. And if we can find the difference in the way that we interact in social circles, from family, in work, in school, the way that people grow with different expectations for life in personal, professional environments. For young women, for example, the concerns regarding their reproductive health and how to grow old living with HIV. Concerns regarding the type of HIV cure as well, we need to take into account. For example, for the functional cure, some might think that it's just another HIV treatment option and not a cure per se. There's a lot of anxiety of rebound and concerns regarding resistance, whereas for eradication, the concept is that you don't need to take another or more antiretrovirals, and the risk of transmission is practically gone, and that you have more sexual freedom. So also for young people, the willingness to participate in HIV cure-related studies, what has been seen roughly is that young people favors are more enthusiastic about therapeutic vaccines and basic law studies, whereas, for example, for latency-ranging agents, they're not very enthusiastic about it. So we need to try to understand what's going on behind that. It's a matter of education, or there's something really for different generations. We need to also understand how to engage young people to get involved in research, try to find what are the personal and social potential benefits of participating in research, and try to communicate them. So an effective communication is essential. We need to know to communicate what the intervention actually means for HIV cure, whether it's eradication or functional cure. We need to explain very, very well, and try to explain also the overall implication of the specific research, whether it's in effectiveness, the potential risk, and the likely outcomes. So there is homework for researchers. We need to understand what's the it mean having an HIV cure for young people? How can they get involved in HIV cure research, and what are the obstacles? So for biomedical research, the other way to go is that when designing a new intervention, there has to be a balance between the effect and the risk in order to be scalable in general. For example, the largely known cases of the Berlin and London patients with the stem cell transplantation of Delta 32 mutation, it is an intervention that is hard to replicate, has high risk, and thus is not scalable. So for research, there is several various phases that we need to have before a new intervention can be approved. And now most of the current HIV cure research are happening in the preclinical and phase 1 studies. But through all of these phases, there are many ways that young people can get involved, not just as participants, but also as students, for example, as young researchers. For example, at Institut Pasteur, where I work, the unit has been focusing on the study of the mechanisms responsible for the HIV replication and the control of clonic information. The focus on early phases of HIV infection, the interplay between innate and adaptive immunity and different subset of cells, the regulation of the infection through metabolic factors, and the study of animal, non-human models, for example, and people like the HIV controllers. But there are many ways in which young people can get involved in research. As I said, not only as students, for example, or as young researchers and participants, but also as advocates for research, for public policies, and for educators, which I think is a very, very important issue for HIV cure research. So the takeaway message are young people are demanding an HIV cure. We need to take into account the generational difference, which are important from the youth perspective. The importance of meeting the needs from young people living with HIV. The research is fundamental, and that young people can get involved in many different ways, whether it's research and advocacy or education, among others, whether it's for biomedical research or for social sciences research related to HIV cure. So we need to be aware that when introducing an intervention or a proposal for an HIV cure, we might have different answers and responses to these interventions that we need to take into account. So finally, I would like to just to acknowledge and thank the wonderful mentors and all the people from the Towards an HIV Cure initiative, to the International AIDS Society, and also to the wonderful people at my unit at Institut Pasteur. And thank you for listening.
Hi everyone, me again. As you know, we were supposed to have a live Q&A, but one of our speakers couldn't make it, so we are going to improvising things. We're going to continue improvising things. I first want to ask and talk to Josephine. I haven't seen you since last year. Hope everything's fine. I know you published a book, but my question is not going to be about your book. I want to ask you about why you think we still need a cure.
Well, I hope I had that right. Is it why we think we need a cure?
Yeah.
Okay, thank you so much. So, as you said earlier on in your introduction, we need the cure because in Africa, and in particular my country, Uganda, a medication is not available to everyone. And we all know that, especially in rural areas where hospitals are very distant, you find that people are facing so many challenges accessing medication. And it is very evident during the because of the lockdown, they would not have transportation, both public and private means. And to make it worse, some reached their facilities and their drugs were not available. You know, there was a shortage, drug shortage. So I think those are some of the reasons why we need an HIV cure. The other reason is the fact that we are seeing many children and adolescents going to third-line treatment. And we all know that there is first line, second line, and third line. And many children, many adolescents at the age of 10, 12, you're on third line. What will the future look like? So what if the cure comes after 100 years? What will happen when you're, 30, 40, when you're already on third line medication at the age of 12? So because of the fact that medication at some point, people are running out of options, there is a very high need for an HIV cure in our communities. Thank you.
Thank you, Josephine. Aurelio, can I ask you the same question? Why do you think we need a cure?
Yes. Yeah, for sure. I would like to say that from the point of view of the people and the people, this is a very hard situation, because even when you have effective treatment for many people for many different reasons, whether it's medical reasons or even social issues like stigma, for some people still live their lives around the virus and around having the HIV. So getting rid of that stigma, of that HIV in general, I mean, it's something that it's fundamental for some people in order to be more free and to live their lives at its full. And from the biomedical perspective also, because even the life expectancy is now practically normal. We have people living more plenty lives than before. We still have a proportion of people that still have health problems, whether it's with the immune system, with the metabolics, or even with secondary effects. So I think it's a big issue for young people, especially.
Thank you, Aurelio. I did have some discussions with my friends who are also living with HIV as into why we need to have a cure still, because some people, I think, feel like what we have already is some type of a cure, because we know you is a proven thing that everyone should be supporting, which they are not. And with treatment, as you said, our life expectancy is pretty much not affected anymore. So why do we still need a cure? I think it is always important to make everyone realize that it is not accessible to everyone, and it doesn't work the same way for everyone. And just because it's okay for you, or you are happy taking your medication today, doesn't mean you are okay with taking it for another 50 years, which is very likely in our case as young people. And if there is a cure, I will not need to take chemicals into my body for the rest of my life, which is what I want, and which is why we're advocating for it and why all the research is happening. But I also want to ask about the collaboration between different sides within the community, HIV community. So I want to ask you, Josephine, so we know research is very complicated, and mostly that part of the community is, I'm going to say, dominated by the researchers and clinicians. Why do you think it is important for us as the community and as the people living with HIV to be involved in the research setting?
Hi, do you mind repeating that? Sorry, my network is a bit.
Yeah, sure. I said, why do you think it is important for patient representatives to be involved in the Cure research?
Oh, thank you so much. So definitely we know that the community needs to know what's happening. And in most cases, people in the laboratory or the scientists, the top scientists, in most cases, they will not get down to the community. So everyone needs to get, of course, they will, but they will not reach out to the grassroots people. But then as the health workers, as the advocates, we are close to these people at the grassroots level. So we need to get involved. Everyone has to get involved. So that as a scientist, as you do your work, as a community member, I'll come in and help simplify your language. And then when I simplify your language, I'll still bring it down to my community people. So it is a chain. When one person is missing, definitely there will be a very big gap. So everyone has to get involved. Thank you.
Thank you, Josephine. Aurelio, what do you think?
I think we need to have the community clinicians and researchers together. First, because it is important. It is important for clinicians and for research to really get to, for instance, the young people and the community. We need to get them involved. If we look at the example of the advantage of antiretroviral treatment, for instance, the community play a major role in what we have now. I will say that many of the technologies and the changes that we have now have been driven by the community itself. So it is important so they can get involved to push towards the HIV cure, and also for healthcare workers and research young people, because sometimes it's difficult for scientists to try to translate the scientific concepts to the community and for young people. So we need to try to be more creative and to try to design better strategies to reach out to young people. We have new technologies that we can use. We have been examples, for example, with social media. So we need to be and push together towards the HIV cure.
Thank you, Aurelio, and thank you everyone for joining our session. I hope you learned a little bit about the Q research and why we all need to be involved. And that's our session for today. Make sure you tune into other pre-conference sessions and enjoy the rest of the conference. Have a nice day, everyone.
Thank you.